President Trump's big, beautiful bill, which includes big cuts to Medicaid, is moving forward after passing in the Senate today with a tie-breaking vote from the vice president. Community leaders are now bracing for its potential impacts if Republicans are able to pass the new version in the House.
News Channel 3's Gavin Nguyen attended a conference today in Palm Springs where local leaders and health experts discussed what's next for our community. Gavin.
John, Karen, that's right. It was a meeting that brought several community leaders and advocate groups together. Their goal, address the instability that those policy changes could bring to a community already reeling from recent immigration crackdowns.
Even if a lot of people ask me, why would I care if I do not carry Medicaid in my life? The reality is that 80 million people around the country actually have it. That means that someone close to us actually depends on it.
Impassioned dialogue from health experts and community leaders alike, stemming from cuts that could limit access to low-income health care for many, including vulnerable people within the Latino community.
We're here to just focus on protecting community health. That is our main charge in today's conversation.
Today's discussion at the Mizell Center in Palm Springs aimed at uniting local leaders on advocating for health care for all. And it comes as immigration enforcement has already placed immigrant communities on edge.
As our communities are being separated, we're here to bring community together so that we can speak collectively under one voice and work together to protect healthcare access and nutrition services here in the Coachella Valley.
And with these potential cuts, officials tell me 3.4 million Californians could stand to lose access to low-income healthcare plans. That comes from President Trump's big, beautiful bill, which includes $1 trillion worth of cuts to programs like Medicaid. And even here on the state level, California Governor Gavin Newsom signing policy that would cut off undocumented immigrants from enrolling into Medi-Cal.
They're incredibly important in general because they provide services that are critical to low-income communities and communities who haven't had access to those services in the past.
And there's been some resistance to those policies here in California, even though new undocumented enrollees aren't being accepted.
The legislature pushed back and was able to stop some of those changes. For now, immigrants will have to pay, starting in 2027, $30 a month.
A change that some representatives are still worried will hurt vulnerable community members.
Our community is living paycheck to paycheck. For many of us, $30 might not be a lot, but for a farm worker that doesn't even make that much in a day, that's our entire safety net.
And organizers tell me today's discussion was the first of its kind in our area in order to start a coalition of like-minded groups here in the Valley. And their next steps, organize and share resources to create a plan on actionable steps they can take to continue advocating for the Coachella Valley community. I'm Gavin Nguyen reporting live in studio, News Channel 3.
Thank you, Gavin. Coming up